You're listening to Foster Your Health Radio.
Hey, this is Dave Foster here with Foster Your Health Radio. Today I'd like to talk a little bit about Broda Barnes, Dr. Broda Barnes, and thyroid therapy, and also in the context, of course, of Dr. Ray Peat, who has stood on the shoulders of Dr. Broda Barnes. Apologize for the audio quality. It's going to be a little subpar because I am on the road and I don't have access to my normal recording equipment. So let's just dive right in. Dr. Broda Barnes is the thyroid therapy founding father. He's the one who had originally pioneered many of the methods that we use today in the naturopathic community. Not that I am a naturopath, but that you're going to use metabolic markers, not necessarily labs, but your body temperature as a guide to supplementing. And what he did, and this is what you could do if you were going to follow what he recommended by his own advice, he had his patients take a thermometer and then they would put it underneath their arm right after they woke up, within 5 minutes after they woke up, before they rose out of bed, and they would take their temperature. They would leave it there for 10 minutes. Their temperature should be between 97.8 to 98.2. And if it was in that range, then they were considered to be euthyroid. And Dr. Broda Barnes would continue upping their dosage of thyroid. He would go, often he'd start them at a grain of thyroid, which of course is, 325 milligrams, but really you just need to know a grain. He uses, or rather used, he's passed away, he used natural desiccated thyroid, NDT. And you could use that, or some people use Cytomel, which is Cynoplus and Cytomel. Cynoplus is synthetic thyroid. And of course there's Synthroid, which is levothyroxine. So basically all you need to know is that Synthroid is T4, levothyroxine. Cynoplus is T3 and T4. You have two hormones, T3 and T4. And Cytomel is just T3. And NDT actually is just like Cynoplus. It's T4 and T3. But the thing about NDT, natural desiccated, is that it only has a thyroid globulin substance in it. And basically what that is your body has to digest it. And then once it digests that, then it gets the thyroid hormones out of that. It gets the T4, T3, in addition to the T2 and T1 and calcitonin, which are relatively biologically insignificant components that you don't need to worry too much about. But some people do report that taking NDT, which is, again, natural desiccated thyroid, has a better effect on them. So he would give one grain to his patients starting out, and sometimes in people with compromised health, he started at a half of a grain, and whenever the certain amount of time would pass, he'd usually wait a month, or sometimes in 6 weeks, anywhere from 2 to 6 weeks. It takes about 6 weeks for the blood levels to reach a steady state, which means that you're going to get most of the effects after 6 weeks. If you raise the dosage too quickly, then you're going to meet undesirable symptoms, because you're going to be suffering or enduring the delayed response from the thyroid that you've taken in the past further away. So if you start at 1 grain, you up it to 2 grains in 2 weeks, you're going to still be gaining an effect from that 1 grain. So he would raise it a quarter grain every couple of weeks or so, or a half grain. And then what he would do is he would continue to have his patients take their thyroid temperature, or rather their temperature, their body temperature, and he would use that to dictate their increase of the dosage or what direction he was going to proceed in. And once they reached 97.8, 98.2, that was a signal to Dr. Broda Barnes that they were approaching the euthyroid range. But actually, he did not even aim for the temperature. He would just keep upping their dosage of thyroid until they gained remission of symptoms. And he would do that until the temperature exceeded 98.2. If it did exceed 98.2, then that would be a sign that they're becoming hyperthyroid, and maybe thyroid therapy did not remain the avenue that they should pursue at that time. Once he stabilized them in a certain temperature range, it would take time for them to recover. For example, he gained widespread remission in a broad range of conditions, ranging from depression to various skin disorders and aches and pains, rheumatism, which is inflammation of the joints, and so on. being that as it may, once he got these people stabilized on the thyroid, he would do other things. He would do diet modification. He would do things like restrict their carb intakes for them to lose weight, which you can debate whether or not that's health promoting or harmful. But regardless, he used thyroid therapy as the base. And once he got that completely covered, then he would go to these other, not mediums, but avenues by which he would approach their health. And so once you start raising your thyroid dosage within his protocol, as he did with his patients, he would recommend, based on what he wrote, that you would take your temperature and that you would be cognizant of sometime whenever you reached a certain dosage that it would take time to work, because sometimes it would take a month or 2 months or 3 months or 4 months before you start feeling some of the positive effects. And we could go into the biochemistry of that, but basically all you need to know is that there is a delayed response in some people when they take these medications, supplements, whatever they are. In this case, it would be a hormonal medication. And this happens again with antidepressants. There's often a stated honeymoon period or an adjustment period, but then even after that, it can take many months for you to experience some of the positive effects of whatever drug you're enduring the effects of. In the case of antidepressants, there's often a lot of negative effects, but of course the benefit there would take a lot of time to build. And so once you would do the 98.2 or whatnot, then you would either throw in the towel or go through different avenues. Now, Dr. Raymond Peat, who built upon a lot of Dr. Broda Barnes' work, what he would do is he would take the natural desiccated thyroids, and what he recognized is that in originally Armour thyroid, which again you can use the ratio of T4 to T3 to kind of decide how you're responding to different concentrations. So some people do better on just T4. A very marginal minority of people, usually younger men, can convert the T4 to T3 because you do need to convert it for it to work. And older women tend to be the least receptive to T4 only treatment. They tend to need a substantially more T3. They can even go as high as, for example, 1 to 2 ratio of T3 to T4, or even as high as the aggressive 1 to 1 or 1.5 to 1. Or rather, 1 to 1.5. And so at that stage, what you're doing is basically the T3 is allowing your liver to convert the T4, because T3, of course, cleans out the liver. It maximizes the detoxification pathways and allows your liver to bind estrogen and excrete it from the body, which has many beneficial effects on your functioning in that organ, one of which is to convert the T4 to T3. And I could go into the use of iodine and the conversion and the different cofactors that you need for that, such as selenium, but it's more helpful just to know that T3 is often needed in higher amounts in older women or in women in general because of the greater burden of estrogen. And again, I'm complexly relating a lot of topics, but basically women have a higher load on their liver because of estrogen, and therefore they need more T3. Men have a lesser load on their liver because of their lower levels of estrogen, in younger men in particular, and so they don't require the aggressive approach of more T3 to T4. And now with that in mind, we could move briefly into something else. We could move into the realm of the changing quality of thyroid. And again, I don't want this to be too in-depth, but with Armour Thyroid was a main brand of thyroid, and with Armour, there was a 1:4 approximately ratio, but it was a little more aggressive than that. It was more like a 1:3.7 or so. And Dr. Peat actually, in his patients, he had an approach where he actually used a more aggressive, he wasn't a clinical MD or anything, but he did recommend a 1:3 ratio of T3 to T4 because he viewed it as more brain favorable. Now, what does brain favorable mean? It means that the brain, because of its intensive metabolism, it requires a higher level of T3 in the blood. And something that's similar to that would be cytomel, which I mentioned before, which is just T3, is actually prescribed by psychiatrists to treat depression. Now, of course, it's not directly prescribed as a first-line treatment anymore because it's not very profitable as the other SSRI drugs or the newer drugs and so on. And there are some risks associated with it, that some of them have some backing and some of them have fraudulent studies behind them, but the concern being that too much T3 can cause bone loss, and it can also cause heart problems. But of course, smaller amounts of T3 are given to heart patients in order to regulate their cardiac output and basically their entire cardiovascular health after going into open heart surgery, for example. And so, with that in mind, the NDT, or the natural desiccated thyroid, has about, which is based off the Armour, is about a 1 to 3.7. Now you can add additional T3 to that, but it's more helpful in a lot of people's cases, they find, whenever they have, of course, a 1 to 4 ratio, and Dr. Broda Barnes found this, and they could stabilize on a certain body temperature. And he found that NDT, natural desiccated, was actually more helpful than synthetics in providing relief to his patients. Being that as it may, you can also add in some T3 over time, of course with doctor supervision and so on, but a lot of people do report clearer thinking at a 1 to 3 ratio of T3 to T4, as Dr. Pete talks about in his articles. So, with that as it may, again, you can use your mood as some kind of feedback to show that the thyroid that you're taking is having an effect, because if you're not responding to it, obviously you won't feel any different. And a lot of the times, some of the negative responses to thyroid has to do with a magnesium deficiency, and it also has to do with poor nutrition, or you're not consuming enough protein, and without enough protein your liver can't really detoxify the estrogen, and so even though you're allowing it to process the estrogen from a hormonal standpoint, it actually cannot get enough glucose to actually convert the T4 or to maintain the conversion. And again, I don't want to go into too complex here, but whenever estrogen burdens your liver, your ability to store sugar, carbohydrate in your liver, is hampered. And to convert the T4 to T3, you need enough sugar, carbohydrate, glycogen in particular, which stored glucose, sugar. So, once you get your diet set, and once you get enough carbohydrate in your diet, that's why people who go low carb have some thyroid issues often over time. And there's certainly, if you go into ketogenic territory, you can become hypothyroid, and you can severely damage your thyroid gland over the long term, although that brings it to another point, or rather guides the conversation that I'm having with myself and to you into that direction, which is that if you have any thyroid suppression, either from a supplement or from your environment, if you're stressed, your thyroid can very easily turn things around. And it can do so very quickly. So for example, whenever you're taking large amounts of thyroid, you can recover the thyroid gland in about 3 days. It's extremely versatile, flexible rather, and it can rebound from stress like that. So, with that in mind, again, with doctor supervision under all of this, you can use these markers to decide the direction of your treatment. And of course, naturopaths who are familiar with Dr. Broda Barnes' work utilize these methods. Now, to introduce more attention to Dr. Pete's work, now that I've covered basically the protein requirements and the carbohydrate requirements, and of course, like I mentioned earlier briefly, you need selenium, so you need a very nutritious, varied diet. Dr. Pete introduced the idea that you can actually use your pulse as an indicator of your thyroid function along with your temperature. So you could use these methods in concert based on the work of these two PhD doctors, or rather MD and a endocrinologist. Dr. Broda Barnes was an endocrinologist, and then of course Dr. Pete had a PhD in biology. And how you use your pulse would be that, of course, you have the morning waking temperature, 97.8 to 98.2, and you can use a similar guide during the day. You can take the thermometer, place it under your arms for a certain amount of time, and then you can, 10 minutes or so. And again, remember that when you take it in the morning, you need to still be in bed, or else the thermometer will show a false positive, rather, or a high temperature, because you're activated in the morning, and you can get your cortisol going very easily whenever you're underfed, and so your cortisol will raise your body temperature. and that will give a false reading. So you can take the thermometer just like you do in the morning, and then throughout the day, you will actually gain an insight regarding the metabolism of your body. And you'll take the thermometer and you put it under your arm, and it should be 98.6, which is a normal temperature. And this would be about 30 minutes after your first meal of the day. And your pulse should be around 85. 80 is okay, but healthy populations, this is Dr. Pete's words, they have their resting pulse around 85 or so. And less healthy populations have it around 75. And so as you look at older people, the healthier older people will have it somewhere around 70 to 80. And then, of course, the less healthy older people will have it around 60 to 70. And the severely ill may have it in their 50s, sometimes 40s, and that's dangerously low. Of course, whenever your pulse is low, although it is low, that isn't, and you feel fine, that isn't necessarily evidence that you're going to acutely die of some disease, but it is evidence that in the long term that would be predisposing you to something such as heart disease or a degenerative condition, cancer, and so on. So 85 resting pulse, 98.6 is your temperature. Now you can also do things like take your pulse in the morning, and you can compare it to what happens whenever you eat your first meal and after your digestive system starts to work. You can pay attention to how your pulse drops, and if it does drop, then that can give you some insight. For example, if you wake up and your pulse is 90 and then you eat and it drops to 60 or 70, then that can give you some insight onto the adrenaline that you have that's raised during the morning. And then of course you eat and then the adrenaline falls. Something else that you can have as an indicator of hypothyroidism that's very common is that you're laying in bed and you get anxiety, or you get panicky, or you feel like you have intense insomnia and you need to eat or something salty, a midnight snack, and so on, which can actually allow your liver to get enough glucose it needs to maintain the thyroid conversion and also to lower your stress hormones so you can actually sleep through the night. So these are all just rough indicators of how you're doing physiologically. So again, if your pulse drops after you eat, or if your temperature drops as well, that's another indicator. If you wake up and you have a high temperature, or after you eat or something, your temperature drops significantly, or you get cold, that can be another indicator. A cold nose, cold hands and feet, those are all indicators that are common symptoms of hypothyroidism. So, again, you want to take the thyroid supplementation in Broda Barnes' protocol. He would do it very slowly. He would raise the dosage over 2 weeks. And then, of course, as you approach something, he would usually never give over 3 grains to his patients. But at times there were people historically or who had reported that they need very high amounts of thyroid. There was one lady called the 12-grain lady, named, of course, because she needed 12 grains of thyroid, that she needed to take an extremely high amount to start, and then she gradually reduced that level over time. So it depends on your current metabolic state, and of course work with your doctor to hone in, but most of the time people need somewhere between 1 and 2 grains or so, or 2 grains. 3 grains is quite high. That's usually reserved for people with severe hypothyroidism or certain hormonal deficiencies that need to be countered in the short term. So now that you got that all set, I know I'm throwing a lot of information out here, but again, I want this to be brief and I want this to be a chunk of information. Feel free to listen to it again, and now just briefly I'll touch upon when to dose the T3. So people who follow Dr. Ray Peace's work, he recommends that you take 1 microgram of T3 every hour, and of course this is more difficult if you take natural desiccated, and so you could nibble on the natural desiccated, the Armour, throughout the day, but many people report just fine. Their health improves significantly just taking their natural desiccated thyroid in the evening or in the morning. Now, Dr. Broda Barnes, he gave it to his patients in the morning, but a lot of people report that taking it before bed actually gives them enhanced sleep quality and can give them a lot of beneficial effects in, again, regulating their hormones in the most stressful period, which is in darkness. And that's a whole nother subject that Dr. Pete covers extensively on to why sleeping can either be restorative or debilitating depending on your thyroid function, because darkness itself triggers a lot of stressful processes in the body because it's hibernation mode. You're starting to wind down, your body signaling stress because you don't have the ability to access food in a more, shall we say, naturistic or a less civilized setting. And so when you take thyroid in the night, it buffers you against that stress. And it's more difficult, of course, to dose the T3 during the day if you take the whole dosage at night, but some people do report that they're just fine taking it once a day. You can experiment. Taking the T4 before bed in particular helps to maintain the conversion, and it also helps to give you, again, through that, give you a reservoir to maintain the conversion, because the T4, of course, is what the T3 from which converts. And then also it suppresses your adrenaline when you take the T4. So you can take the full dose before bed, or you can take it half in the morning, half before bed if you're taking a very high dosage. Some people, they report that they would need to take it split throughout the day. They would need 3 dosing, and with 4 dosing, it's very rare, but 2 dosing tends to be the most that people report any additional benefit from. And again, most people report once daily dosing to be absolutely fine. So, without further ado, or without further brevity, the main takeaway here would be that according to Dr. Broda Barnes and Dr. Ray Peat, you can use physiological indicators to decide your dosage of thyroid, and given that your diet has enough nutrients and you're getting enough light exposure, that's another important thing, and your lifestyle stress is not particularly high, particularly during an adjustment period, you will be able to use the thyroid to adapt to stress, and you will be able to bolster your mood. You'll be able to deal with life stress better. You will feel better overall. And also another thing is that while your initial intake of thyroid can actually increase your heart rate quite significantly, particularly if you go too fast, and it can really debilitate you in certain settings, you can actually improve your ability to tolerate things like anxiety and stress by correcting a thyroid insufficiency, or rather deficiency. And in that case, then you should understand that things are more of a long-term approach, and although you're facing negative psychological symptoms during the acclimatization period, that if you press forward, then you can actually resolve things like depression, as reported by Dr. Broda Barnes, again, in hypothyroidism, the unsuspected illness. And of course, it's similar to antidepressants, where when psychiatrists prescribe their patients some kind of drug that's neurologically, quote, beneficial, then they'll go through a period where their symptoms will worsen. It's called the black box warning. And people can, in that period, experience suicide and so on. But over time, it does improve their state of being. And that's a little different because the way serotonin works is that it's toxic in a sense that, and I won't go into that, but the whole idea, it's a different, but the analogy remains the same, that you need to focus on the war, not the battle. It's a marathon, not a sprint. And so I hope that was informative, and I hope I gave some interesting insight onto all of the articles and all of the literature written by these two figures, Dr. Broda Barnes and Dr. Raymond Peat. And of course, you could check out Broda Barnes. I think it's the Broda Barnes Foundation. They have a lot of information of his. And of course, Raymond Peat, PhD, you can check him out at raypeat.com.
Can't get enough of Foster Your Health? Follow us on Twitter at @real_Dave Foster and join the healthcare revolution at fosteryourhealth.com. While you're there, be sure to check out our new merch. Thanks for listening. Have a healthy day.